Hello to our favorite listeners and viewers. Welcome back once again. This is the Aventure Radio TV Gospel Ministry, where we bring you the end time news, the undiluted word of God, dynamic praise, training effort and gist, and talks on love, relationship, and marriage. And you are welcome back to Fit and Fabulous, your number one health program showing on this station. I am your host, Ajayi Adenike, and of course, we have a guest speaker on the show today that will be taking us on a very important health discussion. And this is no other person than Dr. Oladapo Adetunji.
Thank you so much. It's nice to be back again on the program. I'm always excited to be here to share my own views about some of these topics that we'll discuss.
Thank you so much for coming. We had a nice time on our last episode where we talked about peptic ulcer. If you missed that video, you can check for the link in the description to watch that particular video and also to be enlightened. We said a lot and you shouldn't miss it. So moving on, we'll be talking about another health discussion that is very important for us to know. So if you have elderly ones at home, if you have uncles, aunties, grandpas that are around, we would want them to actually listen in on this topic. It is very important that they know. We are going to clear a lot of myths today. And so what are we discussing today? We'll be talking about osteoarthritis. Yes, it is a very important discussion that we need to have, and we want you to be enlightened. And so we'll be discussing that. We'll talk about the causes of osteoarthritis, how you know you have osteoarthritis, what are the treatments for this condition, and also the misconception that surrounds osteoarthritis. So stay with us, don't go anywhere. So, Sam, what is osteoarthritis? I mean, that name is...
Yeah, it's kind of tongue twisting.
Yes,
it's osteoarthritis. I mean, when you look at the local dialect in which we refer to it here in Yoruba, we call it Rike, Araruru. That's quite tongue twisting too, and the way it's tongue twisting is also the way in which it is complex. Because it's actually a global burden that affects especially midweight people around 45 years and above, in most cases. Okay. Though patients or people that are younger than that age, they have also reported, and we have documents to back that up, presenting with osteoarthritis. So basically, osteoarthritis is a painful chronic condition that affects the joints. Painful chronic condition. That affects, the joints. And if it is not well taken care of, it sometimes leads to permanent deformity. That's just the way I can talk about arthritis. It comes with joint pains. It comes with stiffness of the joints. It comes with inflammation of the joints. So that's what osteoarthritis basically is about. Okay,
so what actually causes it, and in which part of the joints does it usually affect? Is it the whole joints in the body, or just one part, a particular part of the joint in the body?
As of now, we can't really, medical knowledge keeps evolving. Yes. What we have now is that there's no really singular cause of osteoarthritis that we can pinpoint and say, this, once you do this, you're likely to start experiencing osteoarthritis. Okay. But there are some, situations that have been documented to lead to a person having that particular clinical condition. Okay. One of them is obesity. Most of the time when a person is obese and the weight is not being controlled properly, those are predisposing factors to arthritis. Then the kind of job a person does, people that do high pressure jobs, are most likely on the long term to develop osteoarthritis. Later in their year. Also, people that involve themselves in sports that is not well managed. And I'm choosing my words carefully because part of this, we're going to be talking about that later on, is some exercises are usually prescribed for people having osteoarthritis. Now we're talking about exercise or sports could also be a causative factor. Yes. When the sport is not appropriately done, for that particular person that is doing the sport, then it could lead to osteoarthritis. So those are probable causes of osteoarthritis.
Wow. Thank you so much. I want to ask this because I have some people that do a certain kind of skill job, and they complain of they're having leg pains and all that. So people that do tailoring, and people that do hairmaking, because they stand on their feet, and those that do tailoring, they walk with their feet. So I don't know if that have any effect on them later in the years?
Yeah, it does. It does. Just as I said, people that do high pressure job, the pedals,
yes,
of the machine, the feet keeps pedaling up and up, all day long for the tailors and all of that, and then some people. So depending on the kind of job they do, if they don't watch, their body, they don't understand their body mechanism well enough, in the later years they could develop, osteoarthritis. And osteoarthritis, the most common ones are the ones of the knee and probably the ankle. But now we know that osteoarthritis affects every part of the body. All the joints, you could have osteoarthritis in any particular joint of the body. Yes.
Wow. Okay. So how do one know they have osteoarthritis? Now,
the first thing that are pointers or symptoms of osteoarthritis is when you just finished, if we talk about the job, you just finished a particular routine of your job.
Yes.
You saw that after you have rested, the pain starts to go away. You start suspecting osteoarthritis. And then if you wake up in the morning and you have this stiffness around your ankles, around your wrists, your elbows, you start, suspecting that, is this particular situation, is it coming on board in my life? So those are symptoms that the person may have osteoarthritis. Yeah. And then also, when the person is unable to rotate a particular part of the body through the expected circumference. You tell somebody that, lift your hand up, and he or she can only lift the hand up, just to the level of the face and not really above the head. Those are symptoms of osteoarthritis. Just as I said, osteoarthritis is usually associated with stiffness of the joints, pains in the joints, and then inflammation, that's swelling of the joints. Yeah.
Thank you, sir. Now, I'm sure that at this point, we want to know the treatment for this particular condition. Can it actually be cured?
Curing osteoarthritis, well, not cured, but excessively managed. It can be properly managed. That the person will live, a very good life. And I know you were about to talk about the treatment or the management, as the case may be.
Yes.
Now, apart from medical treatments, we need to know, or the viewers need to know this. There is no single treatment pattern for anybody that has osteoarthritis. The rheumatologist, the physiotherapist, the health practitioners that are trained to handle that kind of situation, they know that on a case-by-case basis is what they are going to use in attending to the patient. Now, apart from the medications, there could be some osteoarthritis situations that may need surgical intervention.
Wow.
Right? There could be some that may need surgical intervention. Not all of them, but there could be some that may need surgical intervention. Then there's hydrotherapy. Hydrotherapy is just water therapy.
Oh, okay.
Yes. Sometimes, depending on whichever type of osteoarthritis it is, it may be required that the person places warm water using a warm flask, or a hot water bag on that particular joint. And sometimes it could be cold compress on that particular joint. So you need to use medications that are cold, not the one that is going to inflict pains, or this stinging sensation. That's what they call peppering. This stinging sensation on the body. They don't usually work for arthritis, but anything that is a cold cream that is also an anti-inflammatory cream, they all work. Then I said the other time that if you don't do the right type of sports or exercise, there are factors. That could lead to osteoarthritis. So the cure also is prescribing exercise. You prescribe exercise for people. There was a time we had, I was involved in the management of a patient that had osteoarthritis of the wrist, and the rheumatologist said, look, there's something they call exercise balls. You need to exercise that hand. And the old man was, look, I said my hand is paining me. I have pains, and you are saying I should be using exercise balls. But eventually, after 2 weeks of consistent, exercise, she started feeling better.
Wow.
And now she goes about with the ball and she's happy and all of that about it. So then one other thing is that also diet is very important. In fact, you can't take away diet in anything that we discuss. Eat the right meals. Don't just junk in anything into your system. So that's the way we treat and manage osteoarthritis.
Wow. Thank you, sir. Now, to the misconception about arthritis. We have a lot of things people say about osteoarthritis, and we want to debunk some myths that, people talk about.
Yeah, thank you very much. Now, there are certain misconceptions I'm going to go through. I've listed quite some here. I'm going to go through them. People believe that osteoarthritis is a part of the aging process. That normally when you are growing old, you must have osteoarthritis, and that is not correct. It's not a part of the aging process. Even though we know that from statistics, most of the people that present with osteoarthritis are usually age 45 and above. But it doesn't mean everybody that is age 45 and above would have one type of osteoarthritis or the other. No, that's not correct. Then they say osteoarthritis and joint pain is as a result of the wear and tear on the joints. That's not correct. Actually, osteoarthritis is actually the joint that has worn off, that is trying to replace or repair itself. It's not as if it's the wear and tear. They say my joint is wearing out and it's tearing out. It's not like that at all. It's actually the joint trying to repair itself. Then they say exercise will make your pain worse and your osteoarthritis condition worse. Those are myths and misconceptions. Remember I said the other time, if you don't do the right exercise, then you're going to come down with those osteoarthritic pains. So exercise actually is one of the treatment or management patterns for osteoarthritis. Then let me discuss one more. That when some people say they stop their children, especially the ladies, from wearing high heels, because they feel that once you start wearing high heels, you're going to start having osteoarthritis. That's not correct. High heels or heels does not have anything to do with osteoarthritis. So I just thought I should discuss that.
Thank you so much for that. We've learned a lot today. We've actually learned a lot today. Osteoarthritis affects, older people from at least age 45 and above, but not everyone that is age 45 and above have osteoarthritis. And then the work that we do also affects, what happens later on in the later years of that particular person. And then I think that people that, do these professions, I think they should, I don't know, maybe they should have a regular checkup or maybe know when to rest or how long they should be on their job. On the
job that they do.
Yes, on job that they do.
Yeah, even those that don't even do such jobs too, we tell people once you sit for 1 hour, stand up for 10 minutes.
Move around.
Yeah, move around so that the blood is going to flow, effectively. There's this pamphlet that I'm going to share, with us on one of the work that I did with some of our colleagues at Keele University, United Kingdom, on osteoarthritis, and it will be made available on request. So it talks about a brief guide for patients, that have joint pains. It talks about a deep guide on patients that have joint pains. The pamphlet is going to give you summarized information about some misconceptions about osteoarthritis and the kind of treatment patterns that you should follow, the kind of exercises that you should do, and of course it's going to talk to you also about some meals and the food that you take. So that's going to help you to have a very wonderful time when you are trying to manage osteoarthritis. It's available in English and the Yoruba version. We also have the Yoruba version. So on request, once you send a request to us using this ordained radio link, then we are going to send the soft copy of either the Yoruba or the English version to you as a free gift for listening to this particular episode.
Wow,
on
thank you so much, sir. We appreciate that. So this is very important. So if you are watching right now, if you have someone at home that actually have this condition, I know, struggling with it, it's important that you first of all let them listen to what that have been discussed here.
Yeah, exactly. And
then they can go ahead for more information to get this. So all you need to do is drop a comment saying that you need this particular audio, and then will reach you.
Yeah, we'll reach out to you. You can put your email, or something, or WhatsApp number. We'll reach out to you.
We'll put a WhatsApp number and we'll reach out to you. You can reach out to that WhatsApp number to request for this particular, document. Pamphlet. Thank you so much, sir. I'm sure that we've learned a lot. Please don't forget to share them. If you have any questions, please also drop your questions in the comment section. We will also be in the comment section to answer every question that you have. So we'll be drawing the curtain right here. Of course, we are not going to solely. We'll be coming back again with more health questions. If you have any health challenge you want us to talk about, you can also drop that in the comments, and then we'll be sure to bring it out there and also educate or enlighten you about it. I'm sure we've learned a lot today. Thank you so much,
It's
sir,
always a pleasure
for
to be here.
taking time.
Thank you so much.
And so please don't forget to follow us on all our social media platforms, on Facebook, on Instagram, and on YouTube at Ordained Radio TV. But please don't forget, if you want this pamphlet, please send us a message. We'll be dropping a WhatsApp number that you can send a message to request for this pamphlet, and we'll get it right across to you. Please share this message. There are a lot of people that have this condition and they need to be enlightened as well. We need to clear a lot of misconceptions about osteoarthritis. So at this point, we join the curtain. Thank you so much for staying with us. I remain your host, Ajayi Adetunji, and we are saying a big thank you to Dr. Oladapo for enlightening us once again. Thank you so much,
for having me, for the opportunity.
And so we say bye for now.
Bye-bye.
Thank you.
Okay, bye.